This is Beyond the Stethoscope. I'm Colleen Winecombe. Today we're talking about stroke, but through a lens that doesn't always get enough attention: how stroke affects women. Stroke is a leading cause of death and disability, and while many people know the classic warning signs, what's less understood is that symptoms in women don't always look the same, and that can lead to delays in care. The statistics are also striking. 1 in 5 women will experience a stroke in her lifetime, and stroke kills twice as many women as breast cancer. Joining us to help shed some light on this topic is Dr. Shahid Rafiq, a neurologist with Holy Cross Health. Dr. Rafiq, thank you so much for being here.
Absolutely, it's my pleasure to be here.
Many people don't realize how common stroke really is. I just mentioned some striking statistics, I would say. Why are women at such significant risk for stroke?
Right, so there are, I will come to that, the differences between the two, but
Sure.
I just wanted to highlight how important the stroke as a disease is.
Yes, please.
The stroke is in the whole world, it's the second leading cause of the death. So globally, it's the second leading cause of the death. In America, in USA, it is the third leading cause of death in women, and fifth leading cause of death in men.
Why is
So
that not so?
it's a very different in the two populations.
We often think of stroke as a general health issue, but would it make more sense to think of stroke in men and stroke in women as two different diseases?
Yeah, I would think so. If not from purely scientific point of view, but also to shine a light and to make the society more aware, and the women in particular more aware of these differences. I would think that it would be beneficial if we think of it as a separate disease. And while there are common risk factors, sure, women's body is unique, and women's risk factor for strokes are different, and they should be addressed differently.
So let's talk specifically about risk factors that are unique to women. You've mentioned a few, but could you expound on those a little bit?
So endometriosis is a disease that can happen, and that can cause more strokes.
Okay.
Similarly, the menopause, if it happens early or prematurely, that will also increase the chances of having a stroke. Other unique factors would be migraines are more common in women, and migraine, especially migraine with aura, will cause more strokes. Then contraceptives definitely will cause more strokes. Obviously, the oral contraceptives are uniquely used by ladies and women.
Okay. Those are good to highlight. Thank you, because those are, as you said, not
Right.
the same in men. Do you find that many women don't realize that things like pregnancy or menopause can make them more at risk for stroke later in life?
Right, absolutely. I think a lot of awareness is needed for both, I mean, in general, for the public, but in particular for the women for them to know and be the best advocate for themselves.
Yeah.
Because unless they know those differences, they will not emphasize. When they go to the ER, they have to go to earlier and then emphasize that I think I'm having a stroke, or I might have stroke, so that the ER physician and other healthcare provider, nurses, can get, give them due attention right away.
And how should a woman just be attuned with her body and know what's normal for her and what's not? Because I'm thinking about a woman who's going through menopause or even perimenopause, and they're dealing with fatigue, they're dealing with confusion or dizziness even, or, those kind of generalized symptoms. How do they know? Like, what would you tell them?
Yeah,
This is different.
That is a very, very important question. And the simple answer is the suddenness.
Okay.
I always teach my students as well as general public, anything that starts suddenly
Okay.
can be a stroke. Any neurological dysfunction
Okay.
that starts suddenly is a stroke, because all the other diseases will slowly progress over hours, days.
And when you say suddenly, is
Suddenly,
it
in 1 minute
seconds?
you're talking,
Okay.
we're talking, and next minute you see my face is drooping. So that's very obvious.
Yeah.
But 1 minute you're okay, you're feeling fatigued and weak, but suddenly you feel immense fatigue or immense generalized weakness, or suddenly you feel like you're not well.
Okay.
That can be a stroke.
And that's when you need to advocate
Absolutely.
that it's not anything.
Like we said, call 911. Do not question yourself.
Okay.
Do not call your husband or family members, friends. Call 911.
Call 911
and come to
immediately.
the ER.
We haven't talked about prevention yet. And I know you mentioned before, how important it is for a woman to know her numbers, her blood sugar, her blood pressure, her cholesterol. So it sounds like it's very important, vital, I would say, for a woman to have a primary care doctor.
Exactly.
What else is important for women to know about prevention when it comes to stroke?
If you're on contraceptives, right, young women on oral contraceptives, there you have a risk factor already. Right? So you do not want to accumulate. The more risk factors you have, the higher of your chances of having a stroke. So now you're on oral contraceptives. Then you're having migraines with aura, more common in women, right? And so that's the second. If you're a smoker or smoking, so now you're third. So already you're having three risk factors for having a stroke. So definitely you do not want the fourth one. So please check your blood pressure and ask that number. A lot of time I'm surprised when my patients tell me that, oh, my doctor said my blood pressure is fine. And I said, so what's the number? Oh, I don't know. He said it was fine. No, know your number.
Know it.
When doctor or their medical assistant or nurse take your blood pressure, say, oh, it's fine. Say, thank you, but can I have the number? What is it? Is it 110 over 70 or 120 or 125? So knowing your number, actual number, the higher number and the lower number, systolic blood pressure and diastolic is important because that's your baseline. And if it's increasing, then you want to catch it earlier. So same thing, asking your primary care physician, can I check my baseline lipid panel and whether I'm developing diabetes or not. Then weight, of course, you know your weight. And you know that body mass index, which is a little better than just a random weight because it takes height into consideration. BMI should be between 19 and 24.9.
So if a woman is affected by a stroke, can you talk about recovery at all and what she and her loved ones should understand, the emotional and cognitive components, not just the physical?
The awareness is the key.
Sure.
Because what data and studies tell us that women go later. So there's a window of treatment with the tenecteplase, the medicine or clotbuster medicine is 4.5 hour window at this point.
Okay.
So if you're outside that window, we cannot give you that medicine. So it's very important to detect or suspect the sudden onset of those symptoms that we thought and think about the stroke. Go to the ER, tell them I think I'm having a stroke to put you in front of the queue.
What is the take-home message you most want women to take away from this conversation?
So if you're altered, be fast, call 911, go to, ambulance will come, go to the nearest ER, and in time for 4.5 hour window to get a clotbuster medication if you qualify. And then, of course, after that, thrombectomy.
Follow up and be your best advocate.
Exactly. You be the best advocate. Get your baseline from primary care physician for blood pressure, cholesterol, diabetes, and you know your weight and exercise, and do not drink and smoke, and sleep apnea. Sleep study is very important. Get the sleep study, regular follow-ups with your primary care physician.
That's very interesting. Thank you, Dr. Rafiq. I really appreciate your help in shining a light on this because I think it's very important for women to learn about their risk and to learn about what they can do to mitigate that risk. So thank you very much for being here.
Thank you for having me and addressing this important topic.
Thank you very much for joining us for Beyond the Stethoscope. Don't forget to hit the thumbs up and subscribe to get new episodes.